Hello everyone. I wish you all a happy day, depending from the part of the world you are watching us from, because we have patients, let me call them clients, who are no longer in Nigeria, maybe by my privilege. God made us to meet some time ago, maybe at one time or the other, along the training process of emerging a medical personnel. So that is why I diversified my greetings this evening. Shortly, this one is going to be a short video. Most of the time I've been asked a very important question from our patients, and the question is, why is it that we advise people to take supplement most of the times more than drugs? For example, now, another question is this: why is it that when they take supplements, that it doesn't at the initial time give them what they want, and most of them, as a result of that, they will lose confidence in the prescriber? For example, if I'm the one that prescribed it, they will lose confidence in me. They will go and meet another person, and instead of the person to explain to them how it works, because we live in a world where everybody wants to make money, that other person will come up with his or her own stories. Although I have this to say, coming up with your own story is not going to help the person that you are dealing with. What is going to help the person that you are dealing with is telling the person the truth. Because if you cook up a story so that the person will no longer go back to where he came from to come and patronize you, just because you've seen that the person is actually not, the person doesn't actually know more. Because sometimes when we give them these drugs, some people don't care to read the leaflets inside their drugs. They don't care to read the leaflet inside their supplement. So they just go ahead and take them. And at the end of the day, they will say that it didn't work, because if I were in their shoe, I would say that it didn't work because I was expecting something specific when I went to buy that thing in the first place. And to be frank with you, sometimes most of these drugs are also expensive. Most of them are expensive because most of them are not produced in Nigeria. Let me tell you the truth, apart from all these, what do they call them? Agbo, concoction, ogwigbo, or what I don't know what Hausa people call their own. They have different names that they give to herbal concoction. Apart from that, I'm not sure that Nigeria has actually come up with a pharmaceutical technology to actually produce a standard supplement that is fit for human consumption. They have not actually come with that. We've not actually arrived at uh, that level of technology. So back to what I was saying before. Now, supplements, like I said before, they are different from drugs, and medicines, which I also told you before that drugs and medicines they are the same thing, just that all medicines are drugs, but not all drugs are medicine. All the medicine you take for example now, if you're having paracetamol, you'll be given if you're having if you're having malaria and typhoid fever, you'll be given for example Leonard DS. Leonard DS is a combination of artemether and lumefantrine. It comes in a 120, 20 over 120 for the one that are four. The one you take 4 morning, 4 evening, 4 morning, 4 evening for 3 days. Then it also comes in a by 6. The one that you take 1 morning, 1 evening, 1 morning, 1 evening for just 3 days. So for just these 3 days, it is expected that the malaria parasite in your body should have been taken care of. Actually, when I meant 1 morning, 1 evening, actually I'm just like saying it like that so that you understand what I'm saying. If not, in taking malaria drug, something like any drug that you come across that is written artemether and lumefantrine, normally the way you should take it is the first dose should be taken one start, the second dose that same day should be taken one after 8 hours, then the next one, the next 24 hours, 48 hours, and so on and so forth. It has a way that it is that you should take it. Then take for example the amoxicillin, which most of us know, maybe also be among the drugs that were given to you for the malaria and the typhoid fever. Then you were told to take the amoxicillin, which comes in 500 milligram, one capsule 3 times a day, maybe for 5 days. And that one is just for 5 days. Then they added a paracetamol to it, and they tell you take the paracetamol maybe 3 times just for 3 days. Paracetamol comes in 500 milligrams. So as an adult, you are taking 1 gram or 1000 milligrams 3 times just for 3 days. So that is a sickness which the standard dosing of the drug has been tested, it has been evaluated, and it has been confirmed that within this period of time, these drugs they are capable of taking care of these infections. And sometimes too, there are some funny people, like some people who are they have phobia, or they have this kind of they dislike taking drugs. Some of you agree with me that on the first day that you took that malaria drug, the Lonart, with the amoxicillin and with the paracetamol, that your condition, you saw a drastic relief in your condition, if not concluding that you have gotten well. As a matter of fact, some just take the home for that first day, the second day, and the third day dose. They will discard it, or they will keep it somewhere, maybe for next time. While some will just take for the first day, and the one for the second and the third day, they will keep it somewhere, maybe for the next time, because they feel that they are now okay. Now, the rationale of telling you to take it for 3 days is this: it is because the pharmacist, the maker of this drug, the person that put this drug uh, into clinical trial, that tested this drug through clinical trial, has found out that it will take these complete 3 days, or 5 days of the amoxicillin, or 3 days of the paracetamol for the malaria parasites, the typhoid bacteria, and the fever, the flu, the coughing, the sneezing, the body aches, the hotness of body, the feeling of colds. He has tested them, and he has known that these are the number of days it will take for these things to be cleared off your body completely, irrespective of the relief you felt when you took them the first day. That is how it is with some other treatable illnesses. Now, coming to supplements. Supplements, they are not medications that you just take and you will expect sudden results. No, they are not. Except such a supplement has been prepared with some sensitive herbal extracts. Take, for example, there are some group of substances they call aphrodisiac. They enhance sexual stimulant. Such things, such ones, we classify them. Most of the times they are added into supplements. Aphrodisiac, they are added into supplements so that they know that the people who are taking this drug, they have something urgent that they require from this drug. That is why they came to buy it. So that is why they prepared them that way. So it is not all supplement that works that way. And if peradventure we are people that read the leaflets, or you go to Google and Google some of these supplements which are given to you, not just going to anyhow Google. Most of these companies, they have their websites. You can go to their website, Google out their drug, get more information about it, and you will see that for most chronic diseases like diabetes, like hypertension, like high cholesterol, like which other, anything that has to do with nerve damage, anything that has to do with stroke, anything that has to do with hepatitis, anything that has to do with benign prostatic hyperplasia. Most of these supplements usually need to be taken for a long time before you will start seeing the effects, irrespective of the price. And then nobody is begging you to come and buy again after buying the first one. Even though you go to another place and that person tells you, oh, the one the other person gave you is fake, let me give you the one that will do magic. Let the person give you, let us see, except the person added something into it. But if there are some that I have come across that does this magic, that people who are into networking or network marketing, I'm not against it. I do network marketing, I'm not against it. But what I came to clarify is just the truth and nothing but the truth. That is what I came to clarify. And what I came to clarify is that when a medical personnel is handling anything to you, please And when you are going to meet a doctor or a pharmacist, it's just unfortunate that most of our medical practitioners, they hardly have time for their patients. They hardly have time to interact with their patient, to explain to them how these things work. And that is why they end up uh, being disappointed. They end up complaining. I have many that they have complained to me that this person, he doesn't know what he's doing. You are even younger than the person, and you did this one and you did that one. It worked for me, and that one claimed that he's a professor, he's a consultant, he's this and he's that, and he has been doing this and I have been doing that, and it has not been working. In my mind, I won't really say anything. What I usually tell them is that actually people are different. Maybe the problem is not from the person, or maybe you didn't take this. Sometimes I even try to like tell them maybe they didn't like apply it the way, or they didn't understood the way the person tried to tell them to use it. I try to cover up a bit so that it will not be as if I am, oh, sorry for the light. I believe you can still see me. It will not be as if I am trying to uh, bring somebody down or castigate someone. No, I don't do that. But it must be made clear that every medication, because when we say medication, it includes medicines and supplements, anything that you are taking for to improve your health, to improve the quality of your well-being, they are called medications. So every medication every medication that you are taking uh, every medication that you are taking, you should have a good explanation to how you should take these medications, to how you should use this medication, so that you will not come back disappointed, so that you will not come back complaining, please. And it's also unfortunate that most of the time, before you start explaining something to us, our hands are already with the Bible, would have already started writing, especially with the medical doctors, maybe because there are crowds outside there waiting for them to see them. It is also very wrong. That is not how it is done. That is not how it is done in modern countries. That is not how it is done. It's not done like that. Everybody should be given the suitable and appropriate time that he or she need, depending on the level or the severity of the illness that the person came with. So thank you very much for listening to this brief advice, and may God bless you. Thank you very much. Bye bye.